Welcome back, viewers. So in this video, let us discuss about the various sulci and gyri which are present on the medial surface of the cerebral hemisphere. So this medial surface of the cerebral hemisphere, it is separated from the superolateral surface by the superomedial border. So the medial surface is mostly marked by the presence of the corpus callosum. So corpus callosum is a type of commissural fibers which connect the two cerebral hemispheres. So the parts of the corpus callosum which we see on the medial surface of the cerebral hemisphere are, you see the genome and you see the thickened middle part which is called as trunk or body, and this is the posterior part of the corpus callosum is referred to as the splenium. So the sulci and gyri on the medial surface of the cerebral hemisphere are described in connection with this corpus callosum, that is in front of the corpus callosum, above the corpus callosum and behind the corpus callosum. So if you see on the medial surface of the cerebral hemisphere, the first sulcus which is present is called as callosal sulcus. So this is the callosal sulcus. So this is the callosal sulcus, below which is the corpus callosum. So the corpus callosum is present below the callosal sulcus, and 1 centimeter above to the callosal sulcus, you see a sulcus which runs parallel to the callosal sulcus, and that is called as the cingulate sulcus. So this is the cingulate sulcus. So the cingulate sulcus will extend into the frontal lobe and posteriorly it will end with an upturned end. So this is the cingulate sulcus. So the part of the cerebral hemisphere on the medial surface which is present between the cingulate sulcus and the callosal sulcus is referred to as the cingulate gyrus. So that is about the cingulate sulcus and the cingulate gyrus. And then the part of the medial surface which is present above the cingulate sulcus, it is called as the medial frontal gyrus. So this is the medial frontal gyrus. Now if you see carefully, this cingulate sulcus which is there, it is giving off one offshoot in between which is in parallel to the central sulcus. So this is the central sulcus. So in my previous video when I was describing the central sulcus, I told you the central sulcus will extend onto the medial side also. So this is the extension of the central sulcus onto the medial surface. So just parallel to that, in front of the central sulcus, the cingulate sulcus is giving off one offshoot. So the part of the cerebral hemisphere on the medial surface which is present in front of this offshoot and between the cingulate sulcus and the superomedial border is referred to as the medial frontal gyrus. So this part is called as the medial frontal gyrus. Now the part of the medial surface which is present in between this offshoot and the posterior upturned end of the cingulate sulcus which is present around the central sulcus, this is called as the paracentral lobule. This paracentral lobule is very important. So why? Because it is the highest center for micturition and defecation. So this is the highest center for the micturition and the defecation. So in case the blood supply to this area is hampered, the patient will have incontinence for urine as well as for stools. So because this is the highest center for micturition and defecation. So this is called as the paracentral lobule. And behind this, if you see, you can the area, the quadrangular area, this is the quadrangular area which is present between this posterior upturned end of the cingulate sulcus and this is the parieto-occipital sulcus. So this quadrangular area, this is called as precuneus, and the area which is present behind this parieto-occipital sulcus and the calcarine sulcus, this triangular area is referred to as cuneus. So the major sulci which you see in the medial surface of the cerebral hemisphere is callosal sulcus, cingulate sulcus, then you see parieto-occipital sulcus and the calcarine sulcus. So this is the calcarine sulcus and this is the parieto-occipital sulcus. So the gyri which we see is, first is medial frontal gyrus, paracentral lobule, precuneus and cuneus. So this is called as cuneus. This is related with the visual cortex. So this is cuneus. So this is the frontal end and this is the occipital end. Okay. And then you see the cingulate gyrus and of course you see the corpus callosum. And below the corpus callosum if you see, so this part actually will come into the inferior surface, but we will describe it here. So the major sulci which you see here are the rhinal sulcus. So this is called as the rhinal sulcus in the anterior part, and in the posterior part it is referred to as the collateral sulcus. Rhinal sulcus in the anterior part and collateral sulcus in the posterior part. And then you have got one more major sulcus that is called as occipito-temporal sulcus. So the part of the cerebral hemisphere which is present in front of the above the rhinal sulcus is called as the olfactory area. That is all the olfactory area and it is related to the uncus. And the part of the cerebral cortex above this collateral sulcus is called as the parahippocampal gyrus. Parahippocampal gyrus. And now this remaining part is separated by this occipito-temporal sulcus into medial and lateral occipito-temporal gyrus. So this is present in the inferior aspect of the cerebral hemispheres. So the inferior surface, we will discuss it in detail in the inferior surface. So this is about the medial surface of the cerebrum. So the major sulci are the callosal sulcus, cingulate sulcus, parieto-occipital sulcus and calcarine sulcus, and the major gyri which are seen is medial frontal gyrus, paracentral lobule, precuneus, cuneus and cingulate gyrus. And here you have got the olfactory area and here you have got the para-olfactory area. So these are the major gyri which are present on the medial surface.